We are Group 25 and our project is ChildRun. Childhood obesity has more than doubled in children and quadrupled in adolescents in the past 30 years. It has created both immediate and long-term effects on the health and well-being of children. Our goal is to educate children about healthy and accessible food while also promoting an active lifestyle through our program called ChildRun. There are assumptions that overweight and obesity can easily be reduced, that children are not receiving the nutrition they need because most parents and children do not read food labels or are aware of nutritional value, and that children are eating large portions of unhealthy foods. However, there are external factors to take into consideration. The fast food industry, for example, is constantly targeting and marketing to children. Low-income families may not have the means to buy healthy food, and communities may lack grocery stores that sell fresh produce.
Inputs are resources, contributions, and investments that are made in response to the situation. Our inputs include program staff whose time is being consumed, money spent, as well as materials and equipments needed. We will have the teachers interact with the students the most, while the nutritionists will collaborate with the cafeteria staff to work on healthier alternatives. In regards of time, staff, volunteers, research, and data partners will be the people that are working together to ensure the effectiveness of the program. Money will most likely be spent on developing materials, providing salaries, and for rewards and incentives in the program. The material, equipment, and technologies that will consist of canopies and tents for our outreach activities. We will also have flyers, posters, banners to help promote and educate students as well as their parents. We will also have food ingredients to help guide to healthier choices. With all of these inputs, they all lead to outputs of the program.
In our outputs, one of the first things we are going to do is that we are going to gather and train program staff, volunteer workers, and community partners so that people who will participate, like school administration and school staff, will know the outcome of the ChildRun program. This output will lead to a short, medium, and long outcome. The short outcome will be that we hope to inform the staff about the health risks and make sure that people who are following the program have given their consent. The medium outcome is that we want to implement the ChildRun program in the schools. And the last outcome will be make sure that lives will be improved for parents, guardians, and students. Also, we hope that there will be a reduction in obesity rates.
Another activity that our program will construct is the delivery of educational content about nutrition and exercise in the form of posters, flyers, and newsletters through social media outlets such as Facebook and Instagram. Furthermore, we will also make an effort to receive approvals from local grocery stores and farmers markets with respect to their consent in allowing our program to place posters and flyers within their establishments. Hopefully, our flyers, posters, and newsletters will provide useful information that would educate both parents and children in choosing healthier and affordable alternatives regarding food and physical activity.
Our outreach activities will target San Diego County elementary schools. In order to have our parents and guardians as well as elementary school students to join our program, we are going to conduct health fairs, workshops, and/or classes to educate children about the benefits of healthy diet and exercise. And in order to incorporate healthy eating in schools, we're going to provide fresh produce from local grocery stores and farmers markets to cafeterias to use as a source for ingredients for their menu items. Along with the purchase of fresh produce, we're also going to reformat recipes and menu items in the cafeteria to serve students healthier food. For example, low sodium items, low sugar, reduced fat, and so on and so forth. As a short-term outcome, we want to motivate parents and students to be more aware of their own health decisions. For instance, teaching them how to decipher the values on a nutrition label, or knowing physical activity goals for each age group, as well as other health topics related to diet and exercise. Raising this awareness, we hope to benefit this population with our medium outcome, which is affecting their behaviors on diet and exercise. With support from the parents and community, ChildRun hopes to provide a healthier tomorrow for our children.